Okay, so my previous video I went through the anterior skull. So let's take a look at the side of the skull here during this video. And I'm gonna try to use a little pointer tool. This might help me out a little bit so you guys can see where I'm at. So side view again, as we're going through the skull, a lot of different views. But one thing I want you to notice, it can be really intimidating to look at all these pictures and say, holy cow, I got to know all of that. But understand that when you go through it, even if you're looking at it from different views, um, the structures stay the same, right? So you're going to see these things repeated a lot. So you have the parietal bone. The parietal bone forms the top of the skull and the sides of the skull. Frontal, we've talked about. That's the forehead and the top of the orbital up here. Nasal bone, the bridge of the nose, or basically your the bony part of your nose. Zygomatic, that's your cheek. Temporal bone, that's the side of your head. A lot of structures going on with the temporal bone. I'm going to come back to that in a minute. Occipital, which we did not see on the anterior view, that's the back and base of the skull. We'll come back to that. And then the sphenoid, this thing here, remember on my previous video, I talked about how complex the sphenoid is. We're going to see it in a lot of different spots. Okay, so talk about a couple things. So first of all, sutures. I mentioned in my previous video about all of these sutures of the skull, basically these interlocking joints between the bones. Remember from our previous unit, we talked about how through intramembranous ossification, they replace a membrane and then they'll stop growing once these bones fuse together. So that's basically what happens here. These bones reach each other through that intramembranous ossification, and then they fuse together so tightly that there is no movement here. So even though we call these joints, it's not like a joint with your shoulder or your knee or something like that. No movement in here. So this first one, I know they're not labeled on here, but they're labeled on your page. You have the coronal suture. Coronal is between the frontal and parietal bone. You have the squamous suture kind of along the side of your head here. Squamous suture is between the temporal and the parietal bone. You have the lambdoid suture. Lambdoid suture is back here. That is between the occipital and the parietal. Now, there's some other sutures up here, like a sphenoidal suture and stuff. I'm not going to require those for you to know. Just make sure you know the ones that are labeled on your page. Okay. Now, I said there's a lot of structures on the temporal bone, excuse me. So this one right here where my pointer is, this is called the mastoid process. And you can actually feel this. Run your fingers behind your ear and you feel this big bump right up, basically a little bit inferior and posterior to your ear. That's your mastoid process. Mastoid process, as you tip your head up and down, the muscles of your neck are connecting basically diagonally in both directions. So if your neck muscles pull down toward the right, your head will tip forward. If they pull this way, your head will tip back. This little pointy thing at the base of temporal bone, that's called the styloid process. Styloid process is again on the temporal bone, and it anchors the muscles of the tongue. So we've talked about how the hyoid anchors the muscles of the tongue. Well, so does this. So basically, the muscles can anchor up top and down below. That's why you can move your tongue in multiple directions. It's called the styloid process. This thing right here where my pointer is, that is the external acoustic or external auditory meatus. Basically, that's the entrance for your ear, the ear canal. You have this big flappy thing on the outside of your head, that's your ear. It basically directs sound to this hole here, which has our internal the bones of the inner ear that allow us to pick up vibration and sense sound. And then lastly, not lastly, excuse me, I have this joint right here where the mandible fits into the temporal bone. It's called the temporomandibular joint. Just put those words together. Temporomandibular joint. That's where the mandible is able to articulate and move up and down. Okay. How does this work? Well, there's something called a mandibular condyle, another one of these new words. Condyle is this part of a bone that's going to connect to something else or stick out. Okay, so this right here is the mandibular condyle. It's got to fit into the mandibular fossa. A fossa is a depression. So it's a depression that allows the mandibular condyle to fit into it. So that's the temporomandibular joint. Last thing here, I'm just going to point this out now. We'll see a better view of it later. Notice how a piece of the temporal bone sticks forward towards the zygomatic bone. Okay, these two are going to meet, and it forms something called the zygomatic arch right here. And what that is that's a connection between the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. They meet sort of in the middle, and they form this little archway between those two bones. Now, if I'm going up top here, looking at the head from above, again, a lot of stuff that we've seen before. One thing I want to tell you, these things right here, inferior temporal line, superior temporal line, parietal eminence, I do not want you to worry about those. You can cross those off of your note sheet, okay? But you see some of our sutures, which we've discussed before. This is going across the top of the head. One thing we haven't discussed before is this sagittal suture that goes right down the middle of your skull between the two parietal bones. And then you see our lambdoid suture again there in the middle. Excuse me, not in the middle, at the back of the skull. Again, another different view. Now I'm looking down inside of the skull. Really, this is kind of tough view to look at without talking about the sphenoid and the ethmoid first. So I may come back to this later in a later video. And I'll point out two things here. First of all, look at the sphenoid. Look how big this bone is. It really stretches and spans almost the entire width of the skull. Okay, and what we're going to notice is that there's two wings of the sphenoid. So actually, this part of the sphenoid is a little bit higher than the rest of this down here. Within the sphenoid, I have this depression right here. It's called the sella turcica, or Turk's saddle. Turk's saddle is this thing that houses the pituitary gland. And we'll do a little investigation as to what the pituitary gland does for us. But it actually sits in this sella turcica right underneath our brain. This thing up here, this whole plate, so I'm circling the whole thing, is called the cribriform plate. The cribriform plate is part of the ethmoid, and it is this plate that actually separates the cranial cavity. This whole thing here is the cranial cavity, but right underneath this pink, I guess that's pink, plate is the nasal cavity. So the cribriform plate separates those two cavities, so there's nothing going between them. Now, also, there's this thing called the crista galli that sticks up from the ethmoid. Crista galli there's this membrane called the meninges, meninges, and that's on your notes. The meninges is a membrane that surrounds the whole brain. The meninges is actually anchored or attached to the crista galli, right here towards the front of the skull. This yellow bone is the frontal bone. So you can see how the ethmoid kind of is this little thing that just sticks up right through there in the middle of the frontal bone. This is a great view of a lot of stuff that we've talked about. I'm not going to go through any of it right now. We'll come back to this with our next video. However, I want to point out, remember I talked about that zygomatic arch. There's a great view of it. I have the zygomatic bone sticking backwards. I have the temporal bone with this big thing sticking forward, and they meet right here. So this is the zygomatic process of the temporal bone. This is the temporal process of the zygomatic bone. They meet and form the zygomatic arch. And you can actually feel that on your cheek and on your face if you run your fingers from your zygomatic bone back towards your ear. And I'll stop that video right there.